Functions of thyroid hormone. The first one is calorogenic action, that is heat production. It stimulates heat production in the body by consuming oxygen, which increases the basal metabolic rate. The T3 and T4 increases oxygen consumption of almost all the tissues except for brain, testes, ovary, uterus. Most of the effects of the thyroid hormone are secondary to calorogenic action. That is, increases the cellular metabolic activity by increasing the number and the activity of mitochondria. It also increases the activity of the sodium potassium ATPase, uses energy and increases heat production. The second function is that the thyroid hormone helps in metabolism. So the first one is carbohydrate metabolism. It is diabetogenic. By rapid uptake of glucose by the cells, it enhances glycogenolysis, gluconeogenesis, increases the rate of absorption from the gastrointestinal tract, and increases insulin secretion due to resultant effects. Secondly, it also helps in protein metabolism. It is protein anabolic and increases the synthesis of proteins by increasing translation of RNA, transcription of DNA to RNA, increases the activity of mitochondria and the cellular enzymes. If taken exogenously, it results in protein catabolism. Thirdly, it has an effect on fat metabolism. Lipids are mobilized from the fat tissue and it increases the free fatty acid concentration in the plasma and accelerates oxidation of fatty acid. Increase in thyroid hormone decreases the concentration of cholesterol, phospholipids, and triacylglycerides even though there is increased free fatty acids. It increases the number of low density lipoprotein receptor in liver cells. Therefore, resulting in rapid removal of LDL, that is low density lipoprotein, from the plasma by the liver and subsequent secretion of cholesterol. The third function is action on vitamins. Since thyroid hormone stimulates metabolic processes, it increases the demand for coenzymes and vitamins, thus leading to vitamin deficiency in hyperthyroid patients, especially the water-soluble vitamin B. Deficiency of T4 increases the blood carotene level, resulting in yellowish color to the skin. The fourth function is action on body temperature. Thyroid hormone increases the heat production as there is increase in the metabolic process and the basal metabolic rate, therefore induces thermogenesis. Increase in the thyroid hormone results in excessive sweating. The fifth function is action on growth. There are general and specific effects on growth. Increase in thyroid hormone accelerates the growth of the body, especially in growing children. Excessive skeletal, but however, the bones mature more rapidly and the epiphyses close at an early age. Lack of hormone arrests growth. It is important to promote growth and the development of the brain during the fetal life and the first few years of the postnatal life. Deficiency of thyroid hormone during this period leads to mental retardation. The sixth function is action on the body weight. Increase in the thyroid level decreases the body weight, and decreased thyroid level increases the body weight. The thyroid hormone also increases appetite and may counterbalance the change in the metabolic rate. The seventh function is action on blood. It accelerates erythropoietin activity and stimulates the RBCs, that is the red blood cells. The eighth function is action on the respiratory system. Increased rate of metabolism increases the utilization of oxygen and the formation of carbon dioxide, thus activates the chemoreceptor mechanism that increases the rate and the depth of respiration. The ninth function is action on the cardiovascular system. It increases the catecholamine effect on the heart rate. It increases the excitability of the heart, therefore increases the heart rate, which is an important clinical investigation of hypo or hyperthyroidism. Action on the cardiovascular system. It increases the force of contraction of the heart due to the enzymatic activity. But in hypothyroidism, the heart may become weak due to excessive activity and protein catabolism. The patient may die of cardiac decompensation secondary to myocardial failure and increased cardiac load. Thirdly, it increases the blood flow and the cardiac output by increasing the metabolism in the tissues, releases greater amount of metabolic end products, which results in vasodilation and increases the blood flow. As a result, the cardiac output also increases. Under cardiovascular system, it also has an effect on the arterial blood pressure. It increases the systolic BP as the thyroid increases the rate and force of contraction of the heart and also increases the blood volume and the blood flow, therefore increases the cardiac output. It decreases the diastolic BP. The pulse pressure increases and the mean pressure is not altered. The 10th function is action on GIT. It increases the appetite and the food intake. It increases the rate of secretion of digestive juices and the motility of the GIT. Hence, hypothyroidism results in diarrhea and lack of thyroid hormone causes constipation. The 11th function is action on the central nervous system. Thyroid hormone is important for growth and the development of brain. Deficiency of thyroid hormone results in defective myelination and mental retardation. It increases the rapidity of cerebration stimulating factor. Excess secretion of thyroid hormone results in excess stimulation, further resulting in extreme nervousness and psychoneurotic tendency like anxiety complex, worry, and paranoid disorders. The 12th function is action on the skeletal muscle. Increased thyroid level results in vigorous muscle work. Hypersecretion causes weakness of muscles due to protein catabolism, which is called as thyrotoxic myopathy, wherein the muscles relax very slowly after contraction. Hyperthyroidism causes fine muscular tremors, that is 10 to 15 times per second, due to increased reactivity of neuronal synapses in the areas of spinal cord that controls muscle tone. And lack of thyroid hormone makes the muscle more sluggish.